So Dr. Wilbert C. Jordan, MD, MPH, is a Harvard graduate who has been involved in the AIDS epidemic from its recognition. In 1983, he reported the first heterosexual case of HIV in Los Angeles County. The next year, he started the AIDS Clinic at King Drew Medical Center, now known as OASIS Clinic. He has treated over 3,000 patients, and I would imagine that by now, that number is at a whole another level. We owe a lot to Dr. Jordan. I was having dinner with a really successful medical doctor and someone who actually runs a major organization here in LA County. And one of them actually told a story of when he was in crisis and he didn't think that he was actually going to make it. I won't go into the details of it, but he said, you know what, I came on this side of Wilshire and I went to Dr. Jordan and I got what I needed. And so as a result, I'm still here today. So those testimonies of the work of Dr. Jordan, you know, they're still ringing. You know, and I just want to let you know, to your face, Dr. Jordan, that we love you and we appreciate you for all of the years of commitment and dedication and to the willingness to put your reputation on the line and to step out and advocate for us in places where people were afraid to go and talk about us, to be able to make the level of difference that we see today in our community. And we wanted to be at a different place, but we know we'd be in a much worse place if it weren't for people like you. So thank you for being here. Dr. Wilbert.
Well, it is nice to be here, finally. I saw my first patient in 1979. I didn't know what he had. And when the CDC report came out in 1981, I called him back and I told him, I think I know what you have now. So I've been doing this from the beginning. And I think the reason I continue was because in the early days, I was shocked at how we reacted ourselves. There was only one pastor in this city who would do a funeral in the early days. I'm not talking about Carl Bean as Unity Fellowship. I'm talking about the mainstream churches where people went. And that was Chip Murray. And I can remember calling other pastors. I could hear some running out of the door when the secretary said, hey, Dr. Wilbert Jordan is on the phone. They didn't want to deal with it. They wouldn't touch the patients. There was one funeral home, didn't want to touch the patients. And it was just a time, it was very hard to believe that we would act like this for our own people. If you're HIV negative, it makes no sense to not take PrEP. There's a 96% effectiveness. I shouldn't have to see interview in the clinic if you're HIV negative. There's medicine there, it's availability, take it. There's no reason for interviewing here to not take it if you're HIV negative, period. If you don't know what you are, then go get tested. If you're HIV positive, you're HIV positive. We've lost patients because y'all went to this stupid ass man who called himself a doctor who just died, and he was selling cures. And people would take that stuff, and then they'd come in the clinic about ready to drop dead. You cannot be cured from HIV. Nobody's been cured but one Berlin patient. It's very difficult to get cured, so that's not an option. But you can avoid getting it by taking a pill. Or if you get infected, you're going to end up being required to take more pills for the rest of your life at this point. So that's important. And if you have any question about that, please feel free to ask, because it's not fun to see young kids come in HIV positive. So next slide. 7 cases, what we now call AIDS, were reported in 1981. 2 of those cases were black. I think people forget that because we thought it was basically a gay-white disease at first. Has always been 2 out of 7 is out of proportion more than the black population. So it's always been more in the black community than it should be. Right now, it's ridiculously high in the black community. Next. The 86 cases were reported in black people, representing 1 out of every 5 cases. So we've always had a rather high number. That's 20%. That's more than the population. Next. The first antiretroviral medicine, 1987, a nucleoside reverse transcriptase, was approved by the FDA. And those medicines were hard as hell. The first HIV meds whipped your butt. Be simple as that. They whipped your ass. And you didn't have to tell anyone you were HIV positive if you were taking the medicine. We could look at you and tell. I mean, if you were black, your skin turned purple, your hair became baby, like baby hair. If it was white, I mean, it looked like somebody took a blowtorch and just right in your face. I mean, it was just red. So you couldn't be closeted because the medicines told on you. Then the next medicines made you get the big, really lipodystrophy, buffalo hump, all those things. So the early medicines caused side effects. But for some patients, it got you here. So as bad as they were, a lot of people wouldn't be alive if we hadn't had those medicines. Next. So Magic Johnson announced he had HIV in 1991. And that's been, to me, a good and bad thing. Hip Hop Salt and Pepper releases a hit song, Let's Talk About AIDS. Opened the door to the discussion of sex, AIDS, and other sexually transmitted diseases. That still is a cultural thing in our community. We don't talk about these things enough. We don't talk about it, let alone grandma and grandpa. We don't talk about it, and that's a problem. It becomes the leading, in 1983, it becomes the leading cause of death for black men ages 25 to 44 years of age. I mean, it becomes the leading cause of death, and the leading cause of death for women in the same age group. Tennis star Arthur Ashe dies of AIDS. So, historically, we have always been involved with HIV. Next. So, I don't know, Ray Lewis Thornton becomes the first black woman to talk about living with HIV in a cover story for Essence magazine, 1994. Rap star Eazy-E dies of AIDS. And the first protease inhibitor, a second type of HIV medicine, was approved by the FDA. And when he had it, his doctor called me. He was at Cedars-Sinai. And they didn't want to bring him to Compton where I was because they were afraid the news would get out. I don't think he was in the hospital 5 minutes. So the whole black community knew he was in the hospital. And the first fixed-dose combination pill for treating HIV becomes available. This is something HIV has done that's really affected other medicines. In terms, we have putting 2 and 3 medicines in one pill. You know, we now have good treatments for hepatitis C, 2 medicines in one pill. And really the first medicines like this was really the HIV medicine that called for doing that. There was one point in time I had patients taking up to 48 pills a day. So you try taking 48 pills, just taking 48 pills will make you sick. You take 48 jelly beans, that will nearly make you sick, period. Because again, 48 pills, they may be okay if you took each one of those individual, but they interact with each other. I just got back from the second time we've had this. First International AIDS Conference in Africa was 2000 in Durban, and we just had the International AIDS Conference this year in Durban. The conference is every 2 years. So next year, the international, this is called the World AIDS Conference now. The International AIDS Conference will be next year. That's really more of an academic conference. That's going to be in Paris, and then the year after that, the next World AIDS Conference again. They on even years, it's going to be in Amsterdam. And this year, in the Global Village, there was this transgender group from Papua New Guinea, and a transgender group from Nigeria, and one from Botswana. I mean, not separate places. Each one got their own village. So I asked them, do you dress like this at home? So, no. I said, but how do you dress? I do this every 2 years. So I said, so in other words, the one from Papua New Guinea said, every 2 years I look forward to this so I can come out and be myself for 7 days. Because if I did this at home, I have my ass beat. Now, go back one. The reason I really didn't jump for this, when we had that at that AIDS conference, they had gone to Africa and went to a village and tell people, you all should come out, be proud of yourself, stand up, tell everybody you have HIV. And they went to this village, and this woman stood up, and when they left, they killed her. So when we went to Durban, Phil brought Danny Glover and Matuba. We went to the village. We got there at 11 o'clock, and we stayed until 6 o'clock in the evening to talk to the young man who had killed the woman. They spent that whole day talking to them about it. And at 6 o'clock, the young men, they were crying, and one said to Danny Glover, "You're my favorite African-American actor. I love you. I am sorry that you're disappointed. But she brought disgrace to our village. We killed her, and I don't apologize for it." So it was like, we spent this whole day here, and we ain't changed nothing because we didn't understand their value system. Then the fusion inhibitors came. We rarely used it. I haven't used a fusion inhibitor in about 4 or 5 years. There was another, the next new class of medicine. Next. Then actors in hip hop artist Queen Latifah played a woman living with AIDS in the film Life Support. That was a good movie. We show that at our clinic often. From the beginning of the epidemic through 2010, about 261,000 black people with a diagnosis of AIDS have died in the United States, half of all the people with AIDS. We represent at most 14% of the US population. So any disease that occurs naturally, we should represent 14% of the deaths, not half. Douglas Brooks is appointed director of the White House Office of AIDS. He was the first openly gay HIV positive. He's now at Gilead. He done left that office. Next. So more than 500,000 black Americans are living with HIV. With the highest rate of HIV infection in the United States, with black men under age 24 having the highest risk. The unsaid problem here, most of the patients under 24 don't know they're positive. If you look at young black men who are HIV positive, about 60 to 70% who are under 24 don't know they're positive. And if you remember when you were under 24, that's when you were more sexually active. So they're easily infecting others. And what is unique, I don't quite understand it, but about my patients, as a group, they run in clusters, but everybody in this cluster has screwed each other. So if you have something, it's a matter of time, all of you are going to have it because each of you all infect each other. It's not you're a couple, you're a couple, you're a couple, but it's like, even though you're a couple, you still will have sex with each other. And I think, and that's a problem if someone has an infection. That's why syphilis is so high, and I think we have to deal with it. The other problem with our young patients, no one ever talks to them. I mean, no one has talked to them about HIV. They have no idea what HIV is at all. Some of them come in crying, thinking that you're not going to die now. It's not a death sentence now. You should be taking the medicines. But you should know that. I mean, everybody should know it is not a death sentence now. It was a death sentence at one time, but it's not a death sentence, but you still have to take your medicine. HIV affects black people more than any other racial ethnic group in the United States. And of course, if you compare this to Africa, in Africa it is ridiculous. Sub-Saharan Africa has more cases than the rest of the world combined. Over half of all women in the world who have HIV are in South Africa. Just as in this country, 62% of the women who have HIV are black women. Most of them got it from having sex with a black man. 14 in every 100 people in the United States are black, 14%. Next. Yet 44 of every 100 people diagnosed with HIV were black. Again, that's way out of line. It should be 14. 14, 28, 42, so it's more than 3 times normal. That. And again, late diagnosis. This is the first year I've had black kids come in with early diagnosis. Most times it's the opposite end. They come in very late. And that's been a cultural thing. So why are we waiting so late? But most times people will come in after being infected 7 years, as opposed to a lot of white kids go in early. I mean, they know what they did, and they go right in, I want to get tested. I've been tested 7 times now. Black is usually the opposite. So late diagnosis. Late diagnosis means the virus has had more of a chance to really set up house in your body. It's destroyed more of your immune system, so it's harder to get your immune system back up here. Low HIV literacy and inadequate community-based services to raise HIV literacy. This is very important. We don't talk about it enough. We don't talk about it, and we talk about it, it's negative. We don't really talk about it as a disease. Last year at the National Medical Association, I had an audience response system, and I asked the question, how many of you think AIDS is a curse from God? And 15% answered yes. I said, well, before we go any further, let's deal with this, because this is a stupid answer. I mean, I expected it to be 0. But if this is where you are, this is where you are. But too often, those kinds of statements, Grandma will say something, we don't challenge it, but it's not helping. There needs to be more communication. You all just can't do this in this room. There's a whole group of people out there that need your help, that need you to talk to them. The young kids that we're seeing don't know a thing about HIV. A quick review, we get to end. Okay, it impacts black people more than any other racial group. Low HIV literacy, inadequate community-based services to raise HIV literacy. This is where you all are very important, and limited access to quality HIV treatment have made the HIV problem in the black community worse. The stigma of HIV prevents many black Americans from addressing the HIV epidemic. The only time we were able to get the Congressional Black Caucus to deal with HIV was when we had a woman as president. When we had Maxine and other women as president, they dealt. When it was a man, they were damn scared to talk about it because they were afraid someone was going to wonder why they want to talk about it, as if you are not a part of the black community. I mean, but again, that's your role. You have to be more active and say, I'm a voter. And if you all want to do something, we're going to work to get your ass out of Congress, period. Next. Okay. Learn as much as you can, find a healthcare provider, talk with your healthcare provider, stick to your treatment plan. That's it.
My closing question really has to do a lot with what we're hearing from the state, what we're hearing from the feds, the CDC, and what we're hearing here locally around getting to 0 and ending AIDS. And it, to me, just begins to sound like another catchy slogan that they're throwing out there about ending AIDS. So I want to ask you your professional, personal experience, what you know. Will we ever get to a time in our history where we will actually get to 0 and we won't be having these conversations about HIV and AIDS, that we will actually end AIDS? Will that ever happen?
That's going to be very hard. I think we will get to where the rate is lower, but still we're seeing 50,000 new cases a year. To get to 0 means you nearly got to stop immigration, because you got 20 million people in Africa who are HIV positive, so you got to stop them from coming here to do it, as well as those in Europe, etc. So getting to 0, to me, is a wasted dream. Dropping the rate, yes, we can do that. The gay community has dropped their rate. I mean, it's sort of stable and lower in the Latin community, and it's never been high among the Asian and Asian Pacific Islanders. We're the ones who have a ridiculous astronomical rate. So yes, but we have to do things differently if we're going to drop it. But it means us having to mobilize and get people to get tested. If we got everybody here on PrEP, and you could find everybody who's positive and get them in treatment, then theoretically, his answer is right. We could drop to 0. That to me is really impossible. I don't believe it will happen. I'd love to see it happen, but do I believe it'll happen? No, I don't.
Again, give him a round of applause, you all. Thank you.
Okay.